Yeah, my name's Aron Goodman. I work at the University of California, San Diego at the Moores Cancer Center. I'm in the division of blood and marrow transplantation. Yeah, so smoldering myeloma, which is the precursor to symptomatic multiple myeloma. I think the most exciting things right now are we're starting to get better at risk predicting who's going to progress to active myeloma or not. There's new findings using genomic studies to actually molecularly risk stratify these patients as opposed to the traditional clinical risk factors that looked at the level of M protein, plasma cell production. Right now, the field is pretty eager to start treating these patients. I strongly recommend against this. I think at the time we need to better characterize who's going to progress and figure out who those patients are before we blanket treat all patients with smoldering myeloma. So Castleman's disease, which there's many types, but we'll focus on idiopathic multicentric Castleman's disease, which is that multi-system inflammatory disorder due to overproduction of IL-6. I would say the most exciting therapy is siltuximab, which is a monoclonal antibody to IL-6. Over 50 to 70% of patients will respond, and they'll respond continuously with fairly limited toxicity. For that select group of patients where siltuximab is not effective, more traditional therapies like rituximab chemotherapy and can be used, and there's clinical trials in development right now looking at more targeted agents, including JAK inhibitors and mTOR inhibitors. So for patients with relapsed refractory multiple myeloma, I think the best advice is, what your patient's goals are and really, what their candidacy is for more aggressive therapies. I think for patients that have somewhat good reserve and are fit, cellular therapies, mainly cilta-cel and ida-cel, which are CAR T-cell therapies, can offer an option for a one-time treatment with some toxicity that needs to really be managed and assessed, but the potential for multiple years of durable remissions in this patient population.